Welcome, everyone. Today, I'm joined by Suzanne, who's going to be talking about liberation from chronic pain and symptoms. Hi, Suzanne.
Hi, Stuart.
Hi. Uh, could you, for the audience, briefly introduce yourself and share how you became interested in chronic pain?
Yeah, sure. My name is Suzanne, and I'm a stress illness recovery practitioner. Actually, since 2020, I unfortunately had a lifelong aches and pains here and there. Nothing like that kept me in bed for extended times, but I was always plagued by something. When I was a child, I had growing pains. Then, I got a migraine during my teenage years. Um, an ocular migraine, which was actually quite intense. In some cases, I couldn't even speak anymore, and I couldn't see anymore. Right, your vision is blurry and disturbed, and that was followed by knee pain, back pain, digestive issues in my 20s, and there's always something going on. Like I said, not serious, but something was always requiring healing. So in the process, I investigated probably every healing modality that's out there, like from homeopathy to, manual therapies like acupressure, acupuncture, Ayurveda, supplements. I probably bought more supplements than anyone I know. I, I just always try to get rid of something. And when I did get rid of something, for example, the IBS that I suffered from for quite some time, I got rid of that with a psyllium husk. Then I got a different symptoms in a different spot, and that kept me busy. So my pain kept wandering around my body. And then in 2020, I got my first slip disc, a herniated disc, which was enormously painful. Um, and I was like, why? Because I'm really fit. I do yoga. I horseback ride. I exercise. I hike. I bike. So it's not that I'm not fit. And so this herniated disc didn't really make sense to me, but it had me down for a few months, but then I eventually recovered. But then a year later, just at the beginning of COVID, I got my second slip disc, and that was between L1 and L2. The previous one was between L4 and L5, or most of the disc issues happened, and so this one was higher up, and it was so painful that I literally couldn't move anymore. I went again to osteopaths, and I went to physical therapy and this and that. But I I had this voice inside of me that was really kind of making itself heard, saying, "You've got to look elsewhere. You've got to look elsewhere." And I got convinced that there's going to be something else that's causing all of this, not just this slip disc, but all my symptoms. So I think I did a search, other reasons for chronic pain or something like that. I forgot what exactly I Googled. And finally, I came across Dr. John Sarno, who wrote books about this chronic pain and the mind-body syndrome in the 70s. And so I ordered the book, and I found myself on every page. And he talks about how, suppressed emotions stemming from trauma, stress, negative experience cause chronic pain. And to me, that made so much sense because I had a lot of trauma in my life, a lot of loss, a lot of, even as a child, 2 years old, I my stress started when our house burned down.
All
That's my
right.
first memory actually. So it totally resonated with me that all this chaos, this turmoil, eventually can somaticize and cause chronic pain, because what happens is, like, your brain It's your brain is part of your nervous system, and when your nervous system is, I call it like a container. When the container is full and overflowing, your brain will go and decide, do I give this person pain, or do I let this person feel the issues in the cup? And a lot of times the brain will decide, okay, I am causing pain for her to protect her and to distract her from all the stuff that's sitting in this container. And that's what happened in my case. I mean, I went through my, my decades of life of trauma and stress, and I kept somaticizing the stress, and I never drained the container. I never drained all the trauma and everything else that was sitting in the container. And that made so much sense to me. So I got on this journey to doing whatever Dr. Sarno was advising me to do. And I dug into all possible books and podcasts and whatever else I could find on the mind-body syndrome, which is essentially stress illness, or let's say illness from too much stress, TMS. A lot of people who talk about this call it TMS, and TMS stands for the mind-body syndrome. It stands for tension myoneural syndrome, tension myositis syndrome. Dr. Sarno called it tension myositis syndrome. And so yeah, I dug my teeth into everything. And after like 3 months of practicing TMS, I literally woke up one morning and I had about 80% less pain. I went from
Wow.
not being able to get out of bed for 10 minutes. I had to sit there and wait for the blood starting to flow through my spine. And then finally, I would crawl out of bed. I went from that to getting up one morning, getting out of bed, wondering what happened to the pain. It was literally, okay, it wasn't perfect because I was walking like a croissant for like 6 months. So, I mean, I did have
Great.
a lot of muscle stiffness, but essentially the problem as such that kept me down for so long was literally gone. And then I was wondering, okay, well, how long does it take for it to come back? I still didn't trust the process. I didn't believe 100% in it, but it never came back. And so I kept practicing TMS, which I will get to later, how that really works. Um, I kept going for like a year, and I got rid of my migraine. I got rid of insomnia. This was also a symptom I had for
Mm.
many, many years leading up to the slip disc. So I got rid of so many chronic issues that I suffered from. And when I saw the results, I, s- I promised myself, okay, if this is permanent, I will do the education to become a TMS practitioner, a stress illness practitioner, because I want to share this with everybody out there who suffers from TMS, from the mind-body syndrome. And there's so many people out there who suffer from this, who have chronic pain, but they're still treating it as a physical ailment when in fact it is a stress illness. It's caused by suppressed emotion, by too much stress. So I want to make this more known in the world, especially in Europe, because in the US, this is really gaining traction. There is a number of doctors that are practicing this, that have become pretty famous with this approach. And it's also quite often on national TV in the meantime in the US, but in Europe, unfortunately, there isn't a lot of practitioners. There is some in the UK where I also did my education at Serpa UK. Um, Georgie Oldfield, she's doing a lot in that arena, but on the continent, it's literally almost nobody. So I'm based in Switzerland, and I think I'm the only practitioner in Switzerland, which is quite sad. So sorry, that was a long introduction, but
That what it was, but it's great. I wanted to let you talk. So as I understand from what you said there's like a container inside you. You gave it that sort of metaphor, and like when that container gets too full with stress, it creates symptoms. Did I understand that right?
Yeah, it can. I mean, TMS, it's not something that you can easily understand. It needs a bit of explanation. I mean, a lot of illness or conditions or pain can be TMS, or they might not be, right? It depends a little bit on what are the symptoms? Are they consistent? If a pain is consistently there in the same spot, it might not be TMS. If a pain is wandering, if a pain is only there at certain times of the day or certain times of the week, or if you have a personality that's prone to TMS, where that's let's say a stress causing personality, like a
Mm,
perfectionist or do-gooder or people pleaser, just to name a few. These people
mm,
tend to harbor a lot or to internalize a lot more stress than, say, a type A personality that lets everything out. There's a number of factors, right, that determine if a pain is if a pain is TMS or not. Um,
mm,
Often, you can, for example, do answer a couple of questions or do a questionnaire to see if you, let's say, qualify, if your pain qualifies for TMS or not. But I always advise people to get everything checked out to make sure that the doctor is not missing anything like cancer or infection or autoimmune disease or whatnot, just to be sure everything is ruled out. And I definitely have done that with all my symptoms. I very often did an MRI to make sure that there's nothing structural, but
mm,
it quite often, it's TMS. But it's kind of, yeah, it's in some cases it's hard to say. We can say that, a lot of digestive issues are definitely TMS. We can say that headaches, migraines are TMS. A lot of back issues, even herniated discs like mine, they represent TMS because if you take this, there have been studies, like if you take let's say the whole population of my town, and you take an MRI of their backs, a lot of them will have herniated or bulging discs, but they don't have any pain. So
mm,
oftentimes, you don't have back pain unless you have a full container, unless your nervous system is stressed to the max, and then your brain will decide, okay, I give this person pain in an easy to explain area or not. In some cases it's really subjective. And um and then what happens is, like, the person will run to the doctor and to the specialist, to the healer, to the psychotherapist, to the psychic, whatever, and often they have a diagnosis or not, or they say, I can't find anything wrong. And then, somebody will say, okay, your pain is psychosomatic, but that's the proper term, but it's actually not it's not in your head, it's real. Your brain really causes this pain, and your nervous system can cause some of the most intense pain you could think of, by debilitating nerve fibers in a certain area. And Dr. Sarno has actually proven that locally the brain can cause oxygen deprivation and nerve fiber damage or irritation that can cause some of these pains. So it's your nerve. If you think about your nervous system is everywhere in your body. It literally reaches every nook or cranny in your body. It can reach everywhere, and it can get debilitated, and that can cause pain. And so, yeah, in a nutshell, this is the mind-body syndrome. It requires a bit of delving in and maybe reading a couple books to understand more. But if somebody out there suffers from chronic pain, and I really advise to have a look at the mind-body syndrome, because sometimes it's a factor. It's just a factor, and sometimes it's the solution. In my case, it was the solution to all my ails, but I can't guarantee that for everyone. And if people really understand how the brain works, how the neuroplasticity in the brain works related to pain, how pain is generated and why pain is generated, how the nervous system and the brain can generate pain because of too much stress, that's already that you're halfway there. You're halfway towards pain free because you have exposed the pain for what it is, created by the brain, created by the nervous system. And I mean, just to go a step further, and I know I'm giving you a long winded answer again. I mean, when we have pain, when we're down with chronic pain, our universe only consists of pain and healing that pain and not feeling that pain
Mm.
anymore. Or, for example,
Yeah.
also long COVID is another, let's say, chronic illness. And
Mhm.
then you spend so much time chasing after the solution. And with every chasing, with every expert you consult on your situation, the pain, the neuroplasticity in your brain, we call this the synapses, the pain highway in your brain widens, it gets stronger. So the more solutions you seek, the more focus you put on pain, the bigger your pain gets. We call this the pain fear loop. So the more afraid you are of your pain, or the more frustrated you are about pain, the more experts you consult, the more pain you have, or the more it doesn't have to be pain, the worse the symptom gets, right? And that
Okay.
needs to be broken, that needs to be interrupted. And neuroplasticity is just that. It's very plastic, right? You can um, ameliorate it. You can change your you can update your neuroplasticity in your brain anytime. You have to know how. You have to change the messaging to your brain. And so yeah, that's if you understand this, and if you understand the brain, the nervous system, like I said, you're halfway there on getting rid or healing chronic pain. I hope that made
Great.
sense.
Yeah, I just want to clarify what you said earlier on is like if somebody's had all of the checks and there's like no structural issue, that's what you recommend, right? Get all the checks done, and then if there's nothing structural, that points to TMS, mind body syndrome. Is that right?
Yeah, that's also yes, yes and no. Yes, definitely get everything rolled out, but often the doctor will give you a diagnosis, right? But often a diagnosis is just a diagnosis without a solution. For example,
Mm.
fibromyalgia, right? Okay, you have a term for a disease, but you don't have a solution because medicine doesn't really have a solution except
Mhm.
painkiller, opioids, or whatnot. And often it doesn't work long term, right? You can't give somebody painkillers for eternity. And so also with back pain, as I alluded to, I often you do find every time you take an MRI, in most cases you will find something. But often, let's say you have a bulging disc between L4 and L5, and you have a sciatica going, I don't know, the front of your leg. That doesn't make sense, right? So you oftentimes the doctors will say, okay, yes, here is the finding, and this is the cause for the pain, but it doesn't entirely explain the kind of pain you have, or it doesn't explain how you might only have pain when you're sitting, or you might only have pain when you're driving a car, or you might only have back pain a Monday morning before you go to work. These are all signs and symptoms that your pain may be stress related when it's only a certain time or in a
Right.
certain position or whatever. If you have structural pain, um, then your pain is consistent. Your pain is always there, and that's kind of differentiator. So you have to be careful. And a lot of people are happy when they finally get a diagnosis, because in Western medicine, right, that's really important. And also for society, it's important to have a name for your disease. And you don't want that to be, oh, I have suppressed emotions and I have TMS, because people
Mm,
will think you're nuts, right? But actually that's what it is. But you still have a name. You still have a name for what you have. But the solutioning, the approach to the to the problem is an emotional approach for a physical problem, because mind and body are one. They're not separate, right? And unfortunately in Western medicine you separate the two. Like you have the psychiatrists, the psychologists, and you have the doctors. um,
mm,
they're not really talking to one another, and unfortunately medicine is becoming increasingly specialized. So they're looking at, okay, she has a problem in her sinuses. Let's operate, that piece in her sinus. Let's remove this, whatever. Um, and they're not ever looking at the whole picture. Holistic
mm,
healing is not, unfortunately, practiced by medicine, but we are one. And you can see this when, for example, you get stressed before a presentation or something. You have physical reaction to an emotional problem.
That's me. That's me, by the way.
Or you blush, right? You're embarrassed, you're ashamed. That's a physical reaction to an emotional problem. So chronic pain or chronic symptoms are just a level up. It's a physical reaction to a lot of emotional problems. So the body is somaticizing emotional pain. And they've also, it's really interesting, they've done research, right? And they've looked at brains. A physical injury lights up the same brain part as an emotional injury. It's actually the same, proving that mind and body is can cause the same reaction in the brain and the same pain. So that's,
Mm,
I mean, there's a lot of research out there on this, and I think especially in the US, it's gonna increase. It's definitely going in the right direction, and hopefully, hopefully in Europe as well. But the other thing is that, if people rely on Western medicine, it is, you're outsourcing your pain, you're outsourcing your symptom to somebody to fix it. Unfortunately, when you're practicing TMS, you have to do it yourself. It's a very empowering practice. It's something you do once you've been introduced and explained how it works. Um, it's something you can do on your own by yourself, and in fact you have to. So it's not, I don't have the magic bullet for my patients. They are the magic bullet, and that's when real healing occurs. And in fact, we
mm.
are
Suzanne,
our own medicine.
sorry to interrupt you there, but like, how do you actually help your patients
Yes,
recover then?
okay. I was just gonna say, so as I already mentioned, if you understand how the brain is creating pain, the neuroscience on pain, and what chronic pain actually is, and understand if you have TMS or not, and if so, what has caused it. So when I work with patients, I I go through their whole history of trauma, negative events, negative experience, and then I relate it to the occurrence of pain. So we have a timeline for the trauma and we have a timeline for the symptoms. And then you see how they correlate with one another. And I have yet see one patient where it wasn't correlated. So usually you have traumatic event, and then, sometime after, or literally this, week later or something, you start having symptoms. And it's not obviously consistent, they come, they go, and this and that. So it's very subjective. But then we can really document, okay, this is the history, and this is what I suffer from. And then we can explore um um the solution. And the solution, I mean, part of the solution is really understanding the neuroscience of pain. And then what we also do is something called expressive writing. So a lot of people, they have adverse childhood experience, or they have stressors in their adult life, like divorce, or moves, or financial worries, stressful jobs, or whatever. And they have personality traits that cause stress. So we write the main stressors um, in bullet points. We make a list of bullet points of the main stressors in your life. And then we do expressive writing on each of these bullet points every day for like 20 minutes. And it's not journaling, it's really expressive writing. It's letting the crap out of you. Like, you feel what you put on the page, you really feel it. So I did that for like a year when I first started, did it every day. And I think I never cried as much as in that one year, because there was so much stuff that had to come out, that had to, come out in form of anger, in form of sadness, in form of whatever. So I
Mm.
processed a lot, and I felt like I really decluttered my database in that one year. And as such, you know, drained the container and got rid of a lot of stuff that was kept in there. So that's one of the key things we do. And then we do something called somatic tracking, where you build a different relationship with your pain, and you change the messaging to your brain. So you interrupt that pain fear cycle. That's another approach we use. And then we use something called the havening technique. This is probably too much to explain here, but it's also works to cut the emotional triggers from the memory. And then, we do also certain self-soothing techniques that we use after the expressive writing, for example, to kind of bring your nervous system into a rest and repair state, like heart rate variability tracking and breathing, slow breathing techniques, yoga nidra, for example, the yogic sleep, or we do self-compassion exercises and whatnot. And you know, sounds like a big list, but generally, there's only maybe one or two things that whatever resonates with the patient, that's what we will focus on. Some people say, I cannot write at all. So we find another solution, for example, with talking into a microphone or whatever, but writing is really effective. But the crux of the whole thing is you've got to really understand how the brain works, and how the brain processes emotions or doesn't, and how the brain sometimes gets stuck and gives you chronic pain. And a lot of people have, only by understanding the neuroscience of pain, have gotten pain free. So they didn't have to do the work, as we call it, like the writing or the somatic tracking or whatnot. They didn't do that. They really just understood the animal. They understood the pain and where it's coming from, and the reason for it, and the fact that it's actually not required, not needed. So that's in a nutshell what we do.
Amazing. Such important work. And it's such a shame that modern medicine isn't catching up, at least in Europe. I know in my country, in the UK, like you mentioned earlier, there are a few people, but our NHS, they are still very much in the kind of teaching people to manage their pain and just kind of suck it up and get on with it. Sorry, NHS, I felt like that was a bit harsh, but yeah, they had rather than what you're doing is helping people to recover from their pain, which is gives people
Yeah,
hope.
become pain-free. That's the aim, yeah. Not
Mm.
manage pain. Managing pain is not a solution for me, for my patients. It's really becoming pain-free. Liberation from chronic pain. That's the aim.
And what gives you hope in the future about dealing with chronic pain for your patient? And
Well, what gives me hope is really the development that I've seen in the US with this and how some of the doctors really became very popular, and that the fact that the mind-body syndrome is becoming more something more mainstream. And that's my hope, because when we look at the stats of chronic pain, I mean, they're absolutely shocking. I mean, talking about the UK, there's a quarter of the UK's workforce suffers from chronic pain, and they stay in employment despite the pain. And you know, I think it was 1/5 of American adults, like 50 million people, suffer from chronic pain or symptoms most days or every day. And I think it costs 500 billion each year in the US alone in direct healthcare and disability costs and lost productivity. So
mm,
it's really a huge problem. And I'm just hoping that this will obviously, you don't make money with this, right? I mean, you make money with pharmaceuticals, and that's why obviously this has not got the traction it should have. But with some of the changes in the administration in the US, maybe this is something that they're starting to look at more and more. I'm hoping, I'm hopeful.
okay, great. Well, I'm hopeful too, and it's tremendous work and great story. If people want to find you, Suzanne, where can they find you?
They can easily find me on Become Your Own Medicine, because that's what people will become, becomeyourownmedicine.co. We can also link everything down below, right? But that would be the entry point. I'm also on Facebook, Liberation from Chronic Pain, and also on Instagram.
Okay, brilliant. Well, thanks for coming and having this discussion.
Thank you for
All the best.
having me. Thank you, Stuart.